Assess the patient for allergies to latex, iodine, or tape. Gather equipment: catheter tray, extra pair of sterile gloves, catheter leg strap, bath blanket for draping the patient. Check order and wash hands. Put on clean gloves and drape the patient for privacy. At this time, we would provide pericare and examine the penis. Position the male patient with his knees flexed and feet far apart, or you can have him lay flat with legs close together if you prefer. These positions allow you to set up the sterile field either between the patient's legs or on top of the legs. Remove the catheter kit. Turn the edges of the plastic bag to the outside without contaminating the inside of the bag. Place the bag toward the end of the bed for use as a trash receptacle. The inside of the bag is still sterile, so if your gloves or forceps accidentally touch the inside as you discard them, they will not be contaminated. Position the catheter tray on the bed between the patient's legs or on the patient's lap on top of the thighs. Open the distal flap of the tray first, then both side flaps, and then the flap closest to you last. Touch only the outer 1-inch edge of the margin of the sterile wrapper with your bare hands to prevent contamination of your sterile field. Remove the sterile drape from the catheter kit without contaminating the contents of the tray. Place the sterile drape under the patient's buttocks, holding it by the 1-inch outer margin. This extends the sterile field from the peri area to the catheter tray. Remove the drape with the diamond-shaped opening and place it carefully around the penis. Put on sterile gloves and the catheter kit to prevent introducing pathogens into the urinary tract during catheter insertion. Lift out the plastic tray and place it on the sterile field, avoiding the 1-inch unsterile margin. From the kit, pick up and open the lubricant and squeeze it onto a section of sterile plastic tray. Open the betadine and empty the contents over the cotton balls. Some kits may have swabs. Use another type of antiseptic cleaner if the patient is allergic to betadine. Lift out the sterile catheter. It will be encased in a clear plastic bag. Leave the plastic cover on the catheter while you test the balloon. Hold most of the catheter in your non-dominant hand, especially the tip in the balloon that will be inserted into the sterile bladder. This helps to control sterility of the most important part of the catheter. The rubber catheter will sometimes flex or move while water is instilled. Using your dominant hand, pick up the syringe containing sterile water and screw the luer lock tip to the colored portion of the second lumen of the catheter. This second lumen is located at the Y junction of the catheter. While carefully holding the plastic-covered catheter in your non-dominant hand, use your dominant hand to depress the plunger of the syringe to instill the sterile water, inflating the balloon. Observe the balloon for leaks. Withdraw all the sterile water from the balloon back into the syringe, leaving the syringe attached to the catheter. Carefully remove the plastic cover from the catheter, maintaining strict asepsis of the catheter. Drop the plastic off to the side of the sterile field. Now place the catheter with the attached syringe into the sterile kit within your sterile field. Use caution. Place the first inch or two of the catheter into the lube. This helps to prevent the catheter from flopping from the inside of the box to the outside, and prepares it for insertion. Cleanse the urinary meatus and the entire glans penis or head of the penis surrounding the meatus. Using your non-dominant hand, grasp the penis shaft. Avoid using 1 or 2 fingers and the thumb. Apply full-handed grasp, retracting the foreskin if needed. This hand is now unsterile. Hold the penis at a 90-degree angle to the body while applying gentle traction. With your dominant hand, pick up the betadine swab or use sterile forceps to pick up the betadine-soaked cotton balls. Clean the meatus, moving in a concentric circle until the entire glans of the penis is clean. Drop the swab in the trash receptacle. Repeat cleansing motion 3 times with 3 separate cotton balls or swabs. Remember to use each antiseptic wipe only once, moving in a concentric circle. Do not remove your non-dominant hand from the penis after cleaning it to prevent contamination. Pick up the sterile catheter with your dominant hand, dipping the tip in the lubricant you squirted on the plastic tray. Lubricate approximately 5 to 7 inches of the catheter to facilitate insertion and decrease discomfort to the patient. With your dominant hand, pick up the catheter and insert it into the urinary meatus. Advance the catheter 7 to 9 inches until you see urine flowing into the drainage tubing. Advance the catheter another 1 to 2 inches to ensure that the catheter is fully in the bladder. If you inadvertently inflate the balloon while it is in the urethra, you may damage it. Keep your dominant hand on the catheter to prevent it from sliding out of the bladder and urethra. If you meet resistance when inserting the catheter, the patient may have an enlarged prostate gland. Try gently twisting the catheter to the right to facilitate the tip of the catheter passing the prostate. Do not force the catheter if you are unable to gently advance. Release the penis with your non-dominant hand. Inflate the balloon by depressing the plunger on the syringe completely. Pull gently on the catheter to seat the balloon at the cystrourethral junction. Twist the syringe off the connection port and dispose of it in the plastic bag. Replace the foreskin if it was retracted. If the foreskin is left in the retracted position, it can cause a stricture-like effect, resulting in edema and possible necrosis of the head of the penis. Secure the catheter to the patient's thigh with a leg strap or tape. Some males prefer to secure it to the lower abdomen. Secure the catheter at the Y junction. This prevents tugging of the catheter, which in turn bangs the balloon against the neck of the bladder where the urethra attached. It also helps prevent an ambulatory patient from stepping on the drainage tubing and accidentally pulling out the catheter. At this time, we would cleanse all betadine or other cleanser from the urinary meatus and surrounding area. If left on the skin, it can cause irritation. Hang the drainage bag on the side of the bed nearest the door to allow quick visual assessment. The bag should not be elevated above the patient's bladder. Dispose of trash. Reposition patient and secure call light within reach. Wash hands before leaving the room. Evaluate how the patient tolerated the procedure. Did he complain of pain, burning, or other discomfort? Evaluate the color, clarity, and amount of urine in the drainage bag after the procedure. Avoid allowing more than 1,000 milliliters to drain at a time. Clamp the tubing in between drainings. Document procedure and evaluations.